What is a labral tear? Unknowingly, a vast majority of people walk through life without a labral tear. With a labral tear. As with any ailment, they tend to go ignored and undiagnosed. Not until they start causing pain do people seek answers and treatment. Only within the past 10 years have orthopedics been able to diagnose and treat labral tears. Successfully, labral tears affect people from all walks of life. They can be caused from an acute injury, deformation of the femoral head, or repetitive action over a period of time. The injury was first studied in ice hockey players. It was believed that the repetitive motion of skating slowly weakened the hip wall, causing a breakdown or tear in the labrum. The labrum is this fibrous rim of cartilage around the hip socket. It helps hold the femoral head in the hip socket, thus providing stability to the joint. The labrum also helps seal the hip socket, maintaining fluid pressure within the joint. Symptoms of a labral tear are, of course, hip pain, mainly growing pain or groin pain. The pain may radiate down the buttocks, along the side of the hip, even down the knee. The pain is constant with sharp stabbing jolts with any movement. Patients have experienced the symptoms intensify with long periods of sitting, standing, walking, or even laying down. Most patients avoid rotating the affected hip, pushing off with the injured side, or lifting the leg. This injury is extremely debilitating. The patient can be misdiagnosed at first due to the only recent discovery of this injury. While the injury is fairly new and hard to diagnose, the surgery has a 90% success rate. Many doctors will first inject a steroid shot into the affected hip. If pain is alleviated, then an MRI with contrast is then ordered. The injection is still the main diagnosis tool due to its accuracy. Once a proper diagnosis is made, a plan of treatment is discussed. Some labral tears can successfully be treated with physical therapy or even with the use of a surf strap to hold the hip in place and allow it time to heal. The last option is surgery. Arthroscopic surgery has a very high success rate. During surgery, the surgeon watches through a television and not actually the hip while cutting away the damaged labrum. The surgeon will then sometimes have to reattach the torn labrum to the bone of the hip socket with screws. This procedure is called labral fixation. The recovery time for surgery is between 4 to 6 months. Once surgery is performed and therapy completed, the patient can be expected to return to full normal activities. Life is returned to the patient pain-free.